The client is a university tennis player training 4 times per week. She has a grade 2 right infraspinatus muscle strain. The client is in the mid-phase of rehabilitation and the aim of this program is to improve strength. Here I am asking the client how their injury has been recently and for them to give me a pain scale from 1 to 10, to which they replied 3. I asked for consent to take the client through the rehabilitation program and explained that this includes them attempting exercises that may require me to alter their position and get them to answer questions about their injury throughout the session. This allows the client to make an informed decision about their care, and once the client gives me their consent, we can start the session, starting with a ramp warm-up. The exercise that I have prescribed the client is a sideline external rotation with a weight. This requires the client to lie on their side whilst externally rotating their shoulder at the glenohumeral joint, to bring their arm and the weight up and away from their body and bring it back at a medium to slow tempo and then repeat it. I demonstrate this and ensure that the client knows what to do before allowing them to attempt the exercise, during which I give corrections and ask how it feels and if there's any pain. The coaching points I gave the client were to keep their elbow tucked into the side of their torso, for their arm to remain at a 90-degree angle at the elbow joint, and for their shoulders to remain front-facing and not twist. As this aims to improve their strength, I prescribe 6 to 8 repetitions and 3 to 5 sets. The client also repeats this on both the left and right side so that their movements can be assessed and comparisons can be made to track their progress. If the client were to have significant pain or difficulty in execution during that exercise, then regressions can be put in place to allow the client to complete an exercise with more comfort. This is beneficial as regressions have been said to significantly enhance clinical outcomes whatever their level of function by Blanchard and Glasgow in 2014, theoretical model to describe progressions and regressions for exercise rehabilitation. The first regression for this exercise is a sideline external rotation with weight, but this time isometrically and at a 45-degree angle from neutral. Isometric exercises in rehab help to improve strength in one specific position, and doing this at mid-range puts less stress on the infraspinatus than full range. I give the client the weight once they are in the correct place so they do not have to move isotonically to get to their starting position, which would defeat the purpose of the regression. This will be held for 8 to 10 seconds for 3 to 5 reps, and it will also be completed on both sides. This is another position in which the client could perform the first regression. The principle of holding an isometric contraction at 45 degrees from neutral is the same, however it is done standing using a resistance band instead of a weight. The client may feel more comfortable doing this exercise in this way, as standing instead of lying down decreases the force of gravity in addition to the resistance working against the client, allowing them to complete the exercise with more ease. However, as the client has less contact points with the ground, they become less stable, meaning they have to put more stress on the working muscles to maintain the correct form. Again, this will be held for 8 to 10 seconds for 3 to 5 sets on both sides, and they should use their other hand to pass themselves the band at 45 degrees, so they do not isotonically move the working side of the body to get to the right position. The second regression of sideline external rotation is standing external rotation with a resistance band going through the range of neutral 0 degrees to 45 degrees external rotation. If the client is still in pain and struggling to reach full range of motion, then this exercise helps to build strength in the early range, whilst limiting the chance of pain being caused at the end range of the joint, which decreases stress at extended positions. This has been shown to still be beneficial as resistance training with partial range of motion was not inferior to full range of motion in 2011 from the Scandinavian Journal of Medicine and Science in Sport. I demonstrate this to the client and get them to attempt it for 6 to 8 reps and 3 to 5 sets, giving corrections and asking them for feedback throughout. The first progression for sideline external rotation with weight is standing external rotation from neutral to full range. Using a band with higher resistance, I demonstrate to the client the exercise and ensure they understand it before they attempt it. For this exercise, the client starts in neutral and brings the band away from their body to full range of external rotation and back to neutral. The client told me their pain was 4 out of 10 for this exercise, but they were still comfortable to continue. I gave coaching points of keeping their elbow tucked to their torso and ensuring that their hips and shoulders face forward at all times. This allows me to see their full range of motion at this time during their injury, and doing it on both sides allows me to compare right and left and assess their progress on the injured side. I prescribe 6 to 8 reps and 3 to 5 sets. The second and final progression of sideline external rotation is resisted standing external rotation with abduction. As well as external rotation, the infraspinatus also allows abduction of the inferior angle of the scapula, and therefore it is important for the client to begin rehabilitation of this movement as they move into the late phase of rehab. With their arm abducted, I ask the client to bring their arm up in line with their head whilst keeping their elbow at 90 degrees and ensuring that their arm stays horizontal. I also provide them with a demonstration and remind them to again remain facing forwards. In a study from 2018, it is shown that abduction elongates the infraspinatus, which could have resulted in increased force, by the Journal of Sports Rehabilitation, supporting that this exercise will help improve strength of the infraspinatus. This will also be completed on both sides for 6 to 8